erectile function or dysfunction. Gentlemen and ladies, this is From the Clinic, Thursday Thought with Dr. Tom. Yesterday I saw a very concerned young man, African-American gentleman, had heart bypass surgery, type 2 diabetes, and was complaining that Viagra was not working anymore, and was wondering why, after having his circulation fixed, his heart, why his other parts were not functioning better. And we had to get into a very serious discussion about the fact that atherosclerosis that affected his heart and required heart bypass is universally affecting his entire body and other arteries, including the pudendal artery that supplies the penis. And that fixing the plumbing, if you will, if it's really fixing the plumbing to do not just a quadruple but a quintuple bypass, would affect anything else. It does not. As a matter of fact, it is a very temporary fix, and unless you address the cardiometabolic issues of blood pressure, lipids, and insulin resistance, and he had all three, you're going to continue to progress damage in other arteries, peripheral arterial disease. Usually we think about it of the legs, in this case, another leg, if you will, that is going to go undiminished unless you address the core issues. So I had to have a heart-to-heart, no pun intended, about the need to change his lifestyle. And that the medications, although I did make a switch, I did actually switch to tadalafil, Cialis. I don't prefer the brand names, but whatever. I know that they're more burned into the zeitgeist than the generic names of these medications. But nevertheless, without the help of him understanding lifestyle measures, it's going to be a uphill battle, and it's frankly just not going to work. The fact is, he probably had a combination of some hypogonadism. I will be looking into that. Significant central obesity. We're going to have aromatase conversion of not only aromatase conversion of testosterone to estrogen. Even though you're making testosterone, your body's converting it when you have high body fat content, because the fat cells have a high activity of aromatase, an enzyme that essentially equalizes the sexual hormones, because the difference between testosterone and estrogen is just a hydroxyl group. It's a quick switch one way or the other. So predominance of testosterone turns into equalization towards estrogen, and then vice versa when there's significant amount of adipose or fat tissue. And then the central obesity, and he's a driver, so he's a truck driver, and he has, positionally going to have his testicles pushed up closer to his body. The reason that we have testicles in a scrotum is to keep the testicles at a lower temperature to allow good sperm production and hormone production. And when you have a higher temperature because of either a hanging fat panis, meaning the belly hanging substantially over, almost insulating the testicles, and you're sitting all day because it's a truck driver, you're sitting, you're pushing your testicles in towards warmer parts of your body, you're going to activate heat shock proteins. You're going to reduce essentially the function of the testes in terms of sperm production and testosterone. So that part is probably non-negotiable, right? He's got a job, he has to do what he has to do. I suppose he could think about some fancy fans that might work, but of course I also recommend that he stop every so often to get a walk going, because he was also having some swelling in the legs. And of course he's all spinning out of control feeling here. Yes, you can also get it just as quickly in control once you understand it though, but once you're sitting with a large abdominal girth on top of the pelvic veins, compressing the pelvic veins, you're causing a traffic jam of blood flow upstream, back upstream. Of course, that blood flow gets backlogged and is going to leak out, and it's going to get into the edema spaces or the lymphatic spaces, and you've got lower extremity edema. So it was a bit of a wake-up call for this gentleman. He got very interested in lifestyle medicine. And we started applying some Flex 5 principles, being, careful to not give him a whole entree in one bite. We focused on blood pressure because that is just key, and I've been saying this over and over. So we're really focused on salt. That way it kind of gets away from the calorie issue, and you usually end up getting results anyway, indirectly, as you start to eat healthier. Other things tend to improve that are tagging along, such as, improved calorie density. Eating more fruits and vegetables for potassium is going to also give you less calories per bite and all that. And that way you get a lot of benefit without overloading a patient, but we do have to start stacking eventually the other concepts. So anyway, that is Thursday Thought with Dr. Tom. A little longer than usual. I want to keep it under 5 minutes, but we're at 6. That's okay. We're going to add a lucky 1 there, and you make it a great Thursday. Remember, you've got a free 5-day email education course on the Flex 5 lifestyle. It gives you the appetizers you need. It's all at myflex5.com. MYFLEX, then the number 5.com. And if you like those appetizers and you want to go deep dive, you want to go full entrees and learn about all 5, psychology, nutrition, physical activity, environments, and accountability, cruise on over to my YouTube channel, youtube.com/DrTomMD, youtube.com/@Dr.TomMD, DrTomMD. You could just go to the YouTube app and search for Dr. Tom Rifai as well, right? RIFAI, and then you click on playlists, and the first playlist is the Flex 5 Lifestyle Masterclass. You got 14 hours, 6 months worth at 30 minutes a week, 3 months worth at 1 hour a week. Start from the beginning, but also jump around to the topics that interest you most. If you're going to go grocery shopping tomorrow, you might want to just jump right up to, I think it's lesson 9 in nutrition, grocery shopping, for instance, this is an example. There is a method to the madness. We start off with understanding all of your labs in the intro lessons 1 and 2, because we want you to understand your dashboard. As I'm walking by cars here, right? And I'm from Detroit. Everything's about car analogies. But you need to know your oil pressure, your temperature gauge, all of these things. You need to know, what is my renal function? How do I understand my lipids? How do I check a blood pressure correctly? Why do I need to know what a fasting insulin is? What's an optimal versus normal? All of that's in there, so that you can measure your dose adjustment of your lifestyle and see how it's doing, right? You can't really know how well something's working unless you can measure it. So somehow, that is going to be the wrap here. We got on to lucky 8 minutes. There you go. Take care. Make it a great Thursday, or not. It's up to you.